Welcome back to Daytime. You can alter the symptoms of aging, and Dr. Lee Arsenault and Dr. Carolyn Turek are here to equip you with the information and direction to help you do just that. I'm so excited that you're here because it's something on everyone's mind as we get older. We want to manage the aging process and the symptoms that happen. And so tell me about your clinic and what makes your clinic unique.
I think it's the approach that we take and the services that we offer. So our team is quite diverse, similarly minded, sort of an comprehensive integrative medical team. We have medical doctors, naturopathic doctors, dietitians, nurses, and consultants who all work to make sure that patients look and feel their best.
Absolutely, and that's what we need. And there's two particular things that we're going to be discussing today that helps those patients to look and feel their best. And one of them is bioidentical hormone therapy. So would you tell us what that is?
Sure. I'm actually glad you asked that question, first of all, because I think there's a lot of skepticism out there about treating patients with hormones, yet there's numerous benefits to getting hormones as we age because our hormones are going to be depleted. For instance, giving estrogen, it helps with our brain, our heart, our bone health. It improves memory and cognition. Also progesterone, which balances estrogen, can help with sleep. It improves our metabolism, so it may help us lose weight. And then if we look at testosterone, improvement in libido, bone mass, our muscles, so we have more power and endurance. And overall, taking those hormones either individually or together, it's been shown to improve quality of life and also our sense of well-being.
So where are the hormones made and how are they administered?
So we use bioidentical hormones, and what that means is that they are the same structure as what our body produces. It doesn't really matter whether they're synthetic or natural. It's important that the structure is the exact same as what our body produces, and most of them are made from yam or soy.
Oh, wow. And so when we're talking about how they're administered, is it something where it's a patch? Is it a cream? I've heard of all sorts of different things, but I don't know how this particular one is administered.
Sure. There's different ways that you can apply them. It can be oral, topical, sublingual. We can use injections. It's really very individualized, and I think that's what the difference is as well, that when we use conventional hormones, first of all, they're often not bioidentical, and also it's not individualized to the patient. It's often like a one-size-fits-all, and I think that's one of the main differences.
So what would happen then? A patient would come into the clinic, and how do you assess them?
Well, we do an initial appointment. It's quite extensive. It's usually a 45-minute visit, and do, first of all, a complete physical and history, and then go from there, do blood work, and then bring them back. And then we start the process depending on what their needs are.
Is this something also that can help with hot flashes, night sweats, menopause, those kinds of?
Absolutely significant, yes. And patients come back and say that they have a new lease on life most of the time.
That's amazing, because sometimes you think, well, this is just part of the aging process and I just have to suffer through it. But what you're saying is there is hope and help for what's happening.
Yeah, we often assume that a lot of these symptoms that we just say are sort of nagging and daily, we assume they're the aging process, and it's not always the case. So we have to really make sure that internally they're balanced so we can get the maximal output on the external as well. So a lot of the anti-aging medical aesthetics clinics will just focus on the outside, right? And they'll do the laser for the skin, for example. And what we're looking for are those signals or those clues that something internally is out of balance. So we get the instant results with the procedures and the services, and then we balance them internally to get the long-term solutions.
That is such a great approach. The other item that we wanted to talk about today is the PlateletRich Plasma. So tell us what that is, because that's something, is that something fairly new?
It is fairly new. It's been around for a while, but we've been fortunate to purchase a state-of-the-art machine. It's called a U225 device. And what we do is we draw the patient's blood and spin off the red cells, so you're left with the platelets, which have all the growth factors. We put that in the machine, inject it into the skin, and patients will notice results usually within a month, and they can last up to a year after the injection. And what they usually notice is improvement in fine lines, their skin is glowing, improvement in volume and texture. One of my favorite procedures, and it's natural, so patients love it.
And how long is the downtime? Is there any downtime, or?
There's virtually no downtime with this procedure.
Wow. Immediate results. That's pretty remarkable. So we only have about 30 seconds left. Is there anything else about the clinic that you would like to let our viewers know about?
I think the comprehensive approach. Again, we're looking inside. We have anti-aging IVs as well to help people feel well internally. So we're focusing on the external and the internal at the same time to get the best results, looking well and feeling well overall.
And the one last thing I want to mention, I want to go back to the platelets again.
Sure.
Does that replace Botox and fillers? Is that something that you wouldn't have to then use Botox in order to reduce those lines?
It's a great question. I mean, you can use all of them together, but we actually have found that patients have reduced their need for Botox and filler when we use the PRP.
That's amazing.
Yeah.
Thanks so much for being here today. Up next, we have Chef Vito Clemente. Stay with us.